My name is Tatiana Maida, and I am the manager of Healthy Choices program here at 16th Street Community Health Center. Healthy Choices as a program started in September 2010. But before that, in 2008, there was a small pilot, I think it was 1 year pilot, that was conducted by 16th Street, UCC, and Center for Urban Population Studies, and they developed some curriculum, a 6-week curriculum that was called Familias Sanas y Activas. I was hired in 2010 to continue with that program. It was this one a 12-week curriculum, and it included the whole family. It divided the people by age, by language of preference, and it was really deep in content. And we included exercise, physical activity, cooking, and a little bit of stress management. So that's how it started. And the first year it was focused on the education component of the program, so the families could get education. But in the second year we started the advocacy component of the program, which to me is extremely important, because that makes the education process successful in the future. Obviously the idea is to have the healthier option as the easy option in the neighborhood. And that needs to come from the community. The people needs to move themselves. They need to take action rather than having others or even organizations with the best intentions coming to the neighborhoods and telling people what to do. People needs to take this into their hearts. And that's what we have with our team of Latinos por la Salud. We have people who are really trying to make this healthier neighborhood. In the last action was, I think the biggest one was the Healthy Grocery Store campaign, where we connected with the 2 main grocery stores in the neighborhood, and we requested to include different items that weren't available at that time. So in order to provide healthier options in the stores where people shop the most. There are big differences between immigrants and second and third generation of Latinos in terms of health. The recent immigrants, they are the healthiest group according to some studies in US, but it takes just 5 years to become the sicker group. So that happens with the immigrant generation. The kids, they are in worse shape because they start their lives eating since little fast food and soda, so their health outcomes are gonna be bad very soon. And that's what we see in this health center. We have the pediatrician showing cases of little kids with prediabetes. So that is a very sad reality that we see, and the differences between the parents. That's why it's not joke when you heard that this is the first generation where the parents will kind of outlive their kids. Wherever Latinos go, the same dynamic happens, because we kind of come and we bring this our culture, and the culture, it means eating outside and the food carts. You see you see fruits and vegetables. Even if we're not eating as much as we used to in our countries, still that is very important in the grocery stores in our neighborhood, in a Latino neighborhood.
How would you describe the culture, on the whole, of 16th Street Community Health Center?
I think that's an interesting question. I think our culture is very simpatico with the community. Hire a lot of people who live in the neighborhood, and so people in many cases who work here feel a sense of ownership about the neighborhood and about the care that they're providing for their friends and family and people that they know through their church or through their school, because they live right here. So I think we have a very family-oriented culture, and I also think we have really developed a very professional and quality-driven culture.
The heart of the clinic was the commitment to the community, and the board was really representative of the community. I think at the soul of 16th Street, that commitment to the community, the relationship with the community, that kind of connection to the community is still here, and that's what makes 16th Street so great.
There's a sense that if we're doing something, we want to try and do it the best way we can. And I think that's become a real hallmark of ours.
Everyone believes in the mission, they believe in the culture, they believe in the patients that we take care of, the community that we're in. So everyone is sort of like an ambassador for the center.
When you look at the fact that 30,000 patients or so are now linked to a medical home, have the kinds of supports in asthma and diabetes and in chronic disease management generally, when you look at how Sixteenth really does wrap around patients and becomes their anchor, I mean, the assumption has to be that things have improved. But, you know, for large numbers of people in this community that had nothing in the context of access to medical care, they now belong to a medical home and they have an identified doctor or nurse practitioner or community health worker or whatever the link is. And that's a big deal. That's more than many have.
So where do you see the clinic, you know, in like the next 5 or 10 or even like 50 years?
I don't think community health centers are going away anytime soon, but the healthcare environment is really going through some big changes with the Patient Affordable Care Act and the healthcare marketplaces that are going to be set up. I think we're really well positioned to say, hey, we have an expertise in providing care for Medicaid patients and low-income patients and patients who don't speak English. We have that expertise, and we think that's going to be a saleable expertise in our future.
Ultimately, what we see for ourselves, as we've expressed in our Department of Environmental Health's vision for the future, is a complex of different organizations working together to improve the physical environments that characterize Milwaukee's South Side. And it's not just one sector, it's not, importantly, just the healthcare sector working to do that. It's healthcare, it's housing, it's economic development, it's education, it's commercial and industrial investment and family supporting jobs. And it's also, very importantly, elements of the natural environment too, working to build a community that's vibrant, that's vital, and that is supportive of a community that is ultimately healthy.
In my opinion, 16th Street is moving from taking care of the patients at the clinic to taking care of the people in the streets, in the community outside. And I think that's the way to go.
What we see now is greater incentive being placed not just in the areas of investment in healthcare, but greater emphasis being placed in the areas of community and economic development and in housing and in education around health. People are understanding that the healthcare system that we have lived within has not done a very good job of affecting those upstream determinants really over the course of the last 20 or 30 years. And we're in a unique role sitting within a federally qualified community health center to be able to push us further upstream and to work with other organizations both within but outside of the healthcare sector in order to bring about positive change for our neighborhoods, for our families, for our communities. And certainly I'd love to think that in 20 or 30 years our programming is not going to be necessary. And wouldn't that be wonderful if that was the case? And while we certainly push towards that ideal, I don't think that we're going to be out of a job anytime real soon.
And also, I think it's a happy community. Even if there are struggles regarding immigration papers or regarding money or regarding health, I feel like I go outside and people is happy. And I think that's something I feel very proud of as a Latina.